Welcome to QD Clinic on RA. Hi, I'm Jack Cushwood Room. Now, our first case is going to be about a 29-year-old who has RA for the last 2.5 years. This woman is taking methotrexate. You had her dose of methotrexate escalated at her last visit 3 months ago to 15 milligrams a week. She's also taking 200 milligrams of hydroxychloroquine, which is all she can tolerate since she's only about 105 pounds. She's not doing well the last several visits, which is why you escalated the dose of methotrexate. Today, she still has 5 tender, 3 swollen, and a SED rate of 48. She says she can't go up any further on the methotrexate. And you ask her why. And well, let's put her on a biologic. She says, I'm afraid of biologics. The TV ads are scaring me. Well, why can't we go up on the methotrexate? Well, she says that she's got sores in her mouth. She feels queasy. And after she takes the methotrexate, she's sort of shuts down and lays in bed for a day and a half. And the question is, how are you going to manage this? And this is a QD clinic about treatment pearls for methotrexate. So your options are change her to sub-Q methotrexate, which is, by the way, what the ACR guidelines would tell you to do. 2, increase the folic acid or change her to folinic acid. 3, give her triple DMARD therapy. 4, do what Cush does. Yeah, let's go with 4. Do what Cush does. And let's review the other options. The ACR guidelines say that if you're having problems with tolerating the drug, go from oral to sub-Q, which is the dumbest thing I've ever seen on paper. If you give the drug parenterally, you give more of the drug. As you know, as you give oral and you get over 15 milligrams, you have variable absorption. If you give 15 milligrams IV or sub-Q or parenteral, intramuscular, you get 100% of it. You're going to get more, not less. Nausea, vomiting, sores, blahs. I don't know what the hell they were thinking when they came up with that on the guidelines. Number 2, there's almost no evidence that folate lessens those side effects. Folate lessens the amount of methotrexate discontinuations. That's been proven in a Cochrane report. Adding in other drugs won't lessen the methotrexate side effect. What do? We have 2 problems here. We have oral ulcers. We have queasiness, which is either an oral GI problem or a CNS problem. And then we have a CNS problem, methotrexate blahs. For the oral GI, oral ulcers, nausea, sometimes queasy, very easy. Vitamin A, over the counter, 8,000 every day. Not with the methotrexate, after methotrexate, every day. 8,000 units. You cannot get into trouble. You cannot cause any problems. It will reduce the side effects of oral ulcers, maybe nausea, by as much as 70%. I'm saying 70% of people will respond completely. It's very easy and dirt cheap. Why? Because if you take methotrexate and you squirt it down the throat of a rat, they'll get a hemorrhagic enterocolitis. Pre-treating them with vitamin A prevents that from happening. Learned this from a folate scientist a long time ago. That takes care of the oral ulcers, maybe the nausea. But I think nausea and queasiness is a CNS feature. And that goes along with the blahs. If you survey all your patients about CNS toxicity with methotrexate, 55% will have some kind of CNS features. And the most common one is the blahs. I just really sleepy, can't function, feel like a dish rag. And it resolves in 24 to 36 hours. It is a direct neurotoxic effect of breakdown products of homocysteine and homocysteic acid, which gets taken up by NMDA receptors in the brain, which you can block with dextromethorphan. That's right, Robitussin DM, cough syrup, or guaifenesin DM, Mucinex DM. It works incredibly well, and you only have to give it with the methotrexate and after, 2 or 3 doses. So I like to use Mucinex DM with the methotrexate on Friday night and then give the next dose the next day. So again, this works really well. Same thing, 70% effective. I think this, and we did a study on this showing that this works. Most people don't know about that. This is why I'm telling you to consider this as a pearl when you're faced with these very common methotrexate side effects issues. We want to thank BMS, the sponsor of this month's campaign called Hard Decisions in RA.